Hi, I'm Dr. Kiran KJ. I'm a senior consultant in Department of Minimal Access, GA and Bariatric Surgery. Today, I would like to discuss about bariatric surgery or weight reduction surgery. So you come to me in the OPD, so a lot of people come, doctor, I want to lose weight. Look, I am 90 kgs, my abdomen fat is more, please remove it. So today I would like to tell very shortly what is meant by overweight and what is meant by morbid obesity. So there will be some kind of patients who come with weight around 80 kgs with a height around 5.5. They consider that 80 kg is like a obesity. Accordingly, we don't call them as obesity, we call them as overweight. So you may be asking me, what is the criteria to define the obesity? And what is the criteria to decide the bariatric surgery? Why not we go for bariatric surgery straight away instead of liposuction? Or why can't we go only for liposuction or instead of bariatric surgery? Basically, both the entities are different and there is a lot of confusion among general public about bariatric surgery and liposuction. They are totally different things done by different specialities. So I am a bariatric surgeon. I focus on weight reduction surgery, which is done by laparoscopy. Liposuction is done by a plastic surgeon and the indications are different. So let's get into obesity. What is meant by obesity? It is an excess accumulation of the fat in the body or excess body fat which is affecting our day-to-day routine or our health. So how do you calculate this obesity? We calculate obesity by measuring weight divided by height in meter square. So normally the normal BMI is between 18 to 24. Anything between 25 to 30 is called as overweight. Anything between 31 to 35 is called as grade 1 obesity. Anything between 36 to 40 is called as grade 2 obesity. Anything more than 40 is called as morbid obesity. So this is how we categorize the patient and educate the patient where they stand. So once we categorize the patient, we should get into their details, like we need to ask about their routine, their diet pattern, their exercise pattern, their family history and the personal diet habits or personal habits. So basically, if the patient falls into category of BMI 25 to 30, you call it as overweight, and we usually recommend diet and exercise regime for them to reduce the weight. And anybody in grade 1 obesity, that is 31 to 35, we usually first step we go is conservative, that is called as diet and exercise. Basically, then you may be asking, then where do you indicate this liposuction? Liposuction, this is a procedure which is usually done to one portion of the body, like your tummy is big but rest of the body is okay. So there is excess accumulation of the body fat there. So that and the patient will be overweight. So these kind of patients we usually recommend for liposuction done by a plastic surgeon. Any BMI more than 32 is not very ideal to do a liposuction as well, because the generalized body weight will not be lost. So how do you categorize the patient who is indicated for bariatric surgery, who is indicated for the conservative treatment? So basically the patients, anybody more than 40 BMI should be straight away counseled for bariatric surgery, because they would have been lost all the motivation to do the dieting, exercise and all those conservative means. So anybody more than 40 should be counseled for bariatric surgery. Anybody between 35 to 40 with associated comorbidities should also be considered for bariatric surgery. What is those comorbidities? Comorbidities is nothing but hypertension, diabetes, increased cholesterol levels and truncal obesity and sleep apnea. So we also consider osteoarthritis as also a morbidity. So these are the patients who in the BMI of 35 to 40 we counsel them for bariatric surgery. 31 to 35, the first step we counsel them is to go for a diet modification. We involve a clinical nutritionist. Next is a physical trainer. So this is the first step we go with 31 to 35. Even 31 to 35, especially someone above 33 with comorbidities like diabetes, osteoarthritis, sleep apnea, we consider for bariatric surgery. So these are the indications for bariatric surgery.